Welcome to the Jack Westin MCAT podcast with your host, Phil Hawkins.
And Azaii Muñiz.
Are you feeling overwhelmed? Do you have problems and you feel like you just can't deal with it all? What you need is some coping mechanisms. Now, some of those may be good coping mechanisms and some of them may be not so good coping mechanisms. But this is going to be the topic for today. We're going to be talking about coping mechanisms. And this is something like I was talking to Azaii just a little bit before this about this episode coming up. And I'm like, I feel like I'm going to be identifying lots of things that I'm doing where I'm not coping with things properly. But yeah, hopefully this will be an illuminating episode for everyone.
Phil, that fully sounded like one of those old infomercials.
Yeah.
Call in the next 24 hours and you'll get an extra so-and-so for free.
We'll throw in some denial for free.
Hopefully we might take denial off people's plates. But this is such an important topic, not just for the MCAT, which this is testable on the MCAT. You need to know the different types of defense mechanisms and coping mechanisms. But it's also important just for our everyday lives. And hopefully the way that we're going to walk through the different coping mechanisms will resonate with you and help you think about, okay, how can I remember this for the MCAT? What can I do? What can I think about for my personal life that helps me remember it? But also just take a moment and appreciate we're human and have different coping mechanisms. And maybe there are some things that you can switch up at some point moving forward when the madness of studying settles down. I know that some folks are about to test or maybe have just tested. If you're listening to us after you're testing, hello, welcome back. If you are about to test, good luck. And if you still got a ways to go, let's work through this together. Mm-hmm. So we're going to think about coping mechanisms through a lens that may sound familiar. And that's going to be when someone is studying and they are overwhelmed by studying. This can be for the MCAT. It doesn't have to be. But I suspect that's the one that's going to stick in folks' minds more often. Yeah. And this is something that but like you were saying, this is useful for kind of everyone. Everyone has stressors in their life and learning how to deal with those stressors. I was thinking about a lot of this when I was in med school or studying for the MCAT, but even outside of that, just with I am a foster parent and dealing with parenthood is all of a sudden okay, I did not deal with that situation properly. And I feel like that's what I'm doing at the end of every day. I'm like, I could have done this better. But the big step for all of this, just like in most things, is diagnose first and then treat and then make the improvements. And so you need to be aware of what are these different coping mechanisms. Now, I figured we would start with, this is one I see with a lot of students, which is repression. Where people, they take a test and it doesn't go well. And their immediate response is I'm just not going to look at it. And I'm going to just kind of hide and run away from this thing, kind of repress that memory. And this obviously is not super healthy if you're trying to improve your MCAT score, where people just kind of repress and bury things in their subconscious and get rid of that conscious review of things. But yeah, this happens a lot, especially in when students take practice tests. And so they take a test, it doesn't go well. And then they're okay, I'm just not going to look at it. And I'm not going to review it. And their brain is just pushing that information out of their head, when going and confronting this is actually how you improve and figure out what were the mistakes you made and how to address those. I know we talk about this. A growth mindset is something that's really important. And repression is kind of the opposite of that. Let's not address it. Let's kind of run from it rather than kind of find where are the areas we can improve. Yeah, I think it's important because we're going to talk about another one that's very similar. I think it's important to recognize that repression is unconscious. So it's not something that we're saying, I refuse to ever look at this again. It's our body kind of deciding that for us, deciding I will never look at this again. And so I don't know about any folks who are listening, but this has definitely happened to me where I took a practice full length and it was a very bad experience. In the moment afterwards,
And looking back, I couldn't tell you how I went through that exam, through that practice. My brain decided to repress the memory of taking that full length. And so that's something that can also happen and make it trickier to actually sit down and review. And so I wanted to bring that up because this next one is very similar. And so I want to make sure that we can piece through the two. And that's going to be denial. So denial is, like we were saying, really, really similar to repression in that denial says, I'm not going to process this. This is not actually happening. I refuse to actually experience this. And this is where, so we have that repression of, well, I don't remember what happened during taking that exam. And then denial of, I do not want to address this at all. And so those two kind of, I would say, can go hand in hand at times and be particularly dangerous and detrimental when we're trying to improve and study for the MCAT. Like you're saying, Phil, those kind of go against that growth mindset. And anyone who has heard me in one of the live sessions or even in the course knows that I believe this very strongly, but a weakness is just a strength we haven't cultivated yet, right? And so like you're saying, Phil, being able to diagnose the problem or diagnose the weakness is the first step in being able to improve. And so even when we have a really uncomfortable exam that we've taken a full length that doesn't go our way, a practice section, or maybe you were studying for finals a couple of weeks ago and one of those didn't go too well, and then that transferred onto the MCAT. It's really important to recognize that even though we do not want to face it, we have to be able to review it, sit down. Maybe we don't remember exactly how we thought about a question or thought through a question because maybe it was such an intense experience that parts of it got repressed, but we do our best anyway. And we say, okay, I may not fully remember what happened, but I'm going to try and think about this again and make sure that I have a plan for the next time when I see a really tough question like this.
Yeah. And we kind of decided at the beginning, like, we're going to come at this from the view of like somebody studying for the MCAT because that makes sense. But a lot of times we see this as well, especially repression when there's trauma involved.
Yeah.
Like if somebody was abused or in a car accident or something like that, you will repress those memories, which is basically you're not consciously aware of them anymore. Your brain is kind of hiding those details. And so, like, as I said, like this, it's really hard to tell these two apart sometimes. I think that very often repression is more like backwards facing, where it's like I am repressing something that happened versus a lot of times denial is more about what's happening now, more in the present. So if you like repressed a memory from an exam, you're kind of forgetting that the exam happened and pushing that out of your brain, usually subconsciously, and kind of focusing on that kind of subconscious aspect. Versus denial would be something like, I don't need to worry about studying. I don't need to worry about my scores. And like they're just kind of like going against like I'm not in a problem now. And that is also obviously like not super healthy if you are trying to grow, because you need to identify what areas you need to work on in order to actually improve those. So hopefully that makes sense. I think that like repression, denial, those are ones that are very commonly twisted up. And I want to kind of like point this out. The MCAT is specifically, there's some of these that I think the MCAT is going to try to tie together because they're tricky. And so if they ask you a question where repression is an answer, or is the answer, denial is going to be another answer choice, and vice versa. They're not going to make it super easy where it's like, oh, I'm just not dealing with this thing. And all the rest of them don't make sense at all. They're going to be ones that are a little bit tricky. So repression, denial, just taking that moment to kind of separate those, I think is particularly useful.
Absolutely.
Yeah. So the next one is rationalization, which is like coming up with like focusing on like logic and reasoning and things like this. And people will rationalize stuff, like coming up with reasons. Now, sometimes these reasons can make sense. Sometimes they're like, whatever. This, like, for example, if somebody is so stressed for studying for the MCAT and they find smoking like reduces their stress level. And so they're like, oh, so smoking is healthy for me because I'm going through this stress stuff and this helps reduce my stress level. And like, that's like, there is a logic chain there, but like, I don't think any physician is going to say, you know what, you're right. Like smoking is healthy for you. Like that's not a thing that's going to happen. And so like using this kind of like logic chain to try to rationalize why like a scenario or a situation or a behavior is perhaps okay. Usually you're rationalizing things that tend to be like a detriment or something bad, right? And so rationalizing that is something that you want to be kind of aware of.
That's such an important aspect of this. I don't know if we'd explicitly said before, but these coping mechanisms, they are in response to negative experiences, to fears, to anger, to socially unacceptable thoughts, things like that. And so that's kind of why the body needs them, the mind needs them. It's in order to handle this dissonance and clash between, you know, the id and the ego, if we're thinking Freud, right? And the superego. And so rationalization is something that happens all the time and that people do all the time. You have a conversation with someone long enough and you'll probably find an element of rationalization for something. And I really like that you brought up that example, Phil, of, you know, being stressed and then smoking. That happens a lot. And a lot of you guys as future physicians, you are going to encounter this. I know we had not planned on kind of going down the medical school, medical practice realm, but I think it's important to note you're going to encounter patients who have behaviors that are not healthy. Every single patient is going to have behaviors that are not healthy. We have ways of communicating and talking to patients to help them realize what behaviors are unhealthy, as well as getting a response from them about what they think is actually unhealthy versus it's not a problem right now, denial, right? And you'll also have and hear a lot of rationalization. Well, I only do it X number of times a week, and it's when I'm really stressed, or it's when, you know, I'm out with my friends and we're socializing. So it's fine that I'm having 10 drinks in one night because it's only once a week, right? And it's to help me de-stress, and it helps me function better the next few days or something like that. Yeah. And so this is something that we have to be aware of as future physicians and recognize that you can't brute force your way in a conversation like that, right? It's about understanding where your patient is at, where the other person is at, why they're doing things, what's motivating them. And so you'll hear and learn a lot about motivational interviewing, which is essentially what I just mentioned, figure out what's going on, their perspective, getting them engaged and involved. And so rationalization is a big one that you're going to encounter. Denial and rationalization. Yeah. And so being able to approach those gently will be important in your future career.
I really, you're right. Like we had talked about focusing on this kind of like through the lens of a student studying for the MCAT, but like you have to address, this happens all the time with patients. Yeah. Like for diabetics, and you're like, listen, like, are you avoiding these foods? And like, you give this list, like, yeah, but like, I allow myself like one day a month where I do that. And so like, this was the last day of the month, it was last week. And so I did it that day, but also it was a birthday. And then also my friends came into town, and I'm like, okay, so like 4 of the days last week, you didn't follow this diet that you're supposed to be at. Like, I'm dieting, but like, or like following like the healthier diet, but like, in special occasions I kind of been, but all of a sudden every week there's 3 or 4 special occasions, somehow rationalized, like, well, it was Friday this week. And like, okay. And you see this a lot, with patients. I'm thinking specifically with diabetes because I ran into so many patients with diabetes, and there's something, I think, taking a step back, there's something hardwired into us. Like, we respond to food as a motivator, just like dogs do, and like, you know, other creatures. Like, there's something like hardwired into us, which is why, like, if you tell a kid, like, oh, okay, like once, like if you go to the bathroom in the potty, I'll give you a candy bar. That's a really good way to train, like, or to help potty train a kid. like, and if your goal is to just potty train them quickly. But like, that's why like breaking this, like, you know, food that tastes good is not good is so hard, because I think there's some stuff hardwired into people, which is why we run into this a lot with patients struggling with obesity or diabetes. But it's not just that. It's also like smoking. And like, luckily, there's not a lot of physicians that I know who smoke. But there are a lot of, like, I've seen nurses and physical therapists and radiology techs, and usually there's some form of rationalization going on there. There are some physicians who smoke, but like, I think that has drastically reduced in the last several years.
Yeah. I was on a rotation and I was told about a cardiologist essentially, who for lunch would have at the cafeteria, the fries and the chicken tenders. And someone asked them, "But are you a cardiologist?" "Yes, but I take a statin."
Yeah.
Oh, no.
So that makes it okay.
The
Yeah.
medication does not completely undo the lifestyle modifications. But I've gone off on in the deep end for that one. But I think it's just really important. I thought it was really important for us to touch base on that. I think that it's something that we've all got to have in our minds, that it's going to happen. And we just have to help. We have to make sure that we understand our patients. What are their barriers? How can we help support them with what they need?
Yeah. I do want to address one more thing. Rationalization doesn't have to be bad. Like, I think rationalization is one of those ones that, like, unhealthy or healthy. Like, denial is usually unhealthy. Repression is usually like, there's something you want to address here. Rationalization could be like something, like, it could be like, okay, this actually, like, I am in this really hard scenario. And so while I do want to exercise more, like, I'm going to try to take a walk, and like, that's just as much as I can do. And walking is better than nothing. And so like, there's a rationalization there. So I just want to be kind of careful, because it's one of the few that could be a little bit positive. It doesn't have to be. It's just, you should recognize if that's what you're doing, recognize that that's what you're doing. And like, do I really not have time to exercise because like I'm using this rationalization, like walking is better than nothing. And so I'm just walking, and like, I'm not ever like doing like getting my heart rate up or doing some exertive exercise. When maybe you could find time for that. But if you are in a scenario where you can't find time, walking's better than nothing, absolutely is a rational way to approach it.
I feel came for, Phil.
No.
I love walking.
Mm-hmm, me too.
That you'll find me in the gym, but you'll find me walking wherever. So it's okay.
Yeah, no, I'm the same way. That's pretty much all that I do, except for like rare occasions when I like go hiking or take a trip.
So our next coping mechanism after rationalization is going to be one in a few that can get mixed up a bit. And so that's why we're clumping them together. The first one in this is going to be projection. So with projection, I'm going to refer to myself here. I may have feelings or motives or some kind of experience that makes me uncomfortable, that I do not like, that I am the one with those experiences or feelings. And so the way that I'm going to cope with it is to attribute or project my feelings onto someone else, or onto someone else. So for example, if I am studying, and let's step away from the MCAT, though there's one from the MCAT that will maybe be very helpful. But I'm studying for an exam, and I know that the exam is going to be hard. And I really don't like the professor because the exams are hard. What I'm going to instead create the scenario of is the professor doesn't like me, and so they make the exam really tough. Or the professor is mean and they're making the exam really tough. I'm taking my feelings, which is that the professor sucks and that the exam is hard. I don't like that. And that switching it. Or the MCAT is awful and just shouldn't exist. Oh, the MCAT hates us and the AAMC is trying to make us fail, right?
Yeah.
I'm taking these feelings, and that was not a perfect one-to-one, but essentially taking these feelings that are my own, projecting them onto someone else and saying that those people are the ones that, or in that case, the MCAT, are the ones that actually hold those feelings or thoughts.
Yeah. So it doesn't have to be on the one that is doing it to you either, right?
Mm-hmm.
Like if you're really frustrated with studying for the MCAT and like I hate studying right now. Like I am at a place, and then you talk to like a sibling who's like in college or high school, and so I'm like, no, you just hate studying. Like, and they're like, no, I'm actually really enjoying my classes. I'm like, no, you hate them, right? Like I'm projecting my feelings of like anger of having to sit inside and study all day and projecting that onto someone else. Or like, it could just be that I'm frustrated because I really want to be like, I want to do stuff with friends. And I'm spending so much time studying that I'm like missing out on stuff. And you kind of like have that feeling. And so then when you like talk to other people, like siblings or parents or friends, and you're like, don't you hate that you just can't go out with friends all the time or more often? And like, no, like I go out with friends as like, I'm just kind of introverted. Like I don't really like going like, and then internally you're like, no, that's not the case. Like they have these feelings. And I'm like, no, it's you have those feelings, and you're just projecting those onto other people. So if you're angry or frustrated, which often happens, like just in general, and you start to think other people are angry and frustrated, and that's not necessarily the case. So that's this idea of this projecting your internal feelings onto somebody else and saying that they have them.
Yeah. And I think this one can be trickier to recognize. Like if we're just thinking about, okay, what kind of fast or rewinding to what we talked about at the beginning, are there ones that we can recognize that we're using? So something like rationalization might be easier for us to pick up on. We can hear that internal dialogue, right? But with something like projection, if you're not actually asking the other person if they have those feelings, it can be really tough to identify. And so inevitably, people will often, think, okay, this must be what that person is thinking, right? This must be what that person is feeling. But recognizing that we don't always know and we are not in someone else's head. And so there are times where you just have to ask someone, is this how you're feeling? Does this make sense? Does this resonate? So something else to think about, but you want to make sure that you keep this in mind. Another future medical analog is that this is going to happen with patients. Patients may feel their frustrations and may project. And so it's important, again, to come from a place of trying to understand patients and meet them where they're at so that you can best support them through whatever medical capacity you can support them.
Yeah. I feel like I've seen that a fair amount, not as much often with like patients, but often with patients' families.
Yes.
Where they I just saw your eyes like blow up. Like, yes, there are some great examples where like a patient is like the patient's family, like a family member is very frustrated with, I don't know what to do. I don't know how to help. I feel like I can't solve the scenario. I feel like more needs to be done, and like more like there needs to be more like movement and action and like medicine and curing. And so they come to you as a physician or someone working in healthcare, and they're like, listen, my family member who is sick is unhappy about how they're being treated. I'm like, and then you go talk to that patient, like, no, everything's great. Like, I feel like I understand everything that's going on. We're making good steps. And like, they're fine, but it's the family member projecting their feelings onto the patient and then confronting you and saying the patient feels this way. And like, the patient doesn't actually feel that way. It's the family member who's feeling powerless and doesn't know like how to find a good outlet for that. You see this a lot with like other people in the hospital.
If this is starting to sound a bit scary, keep in mind that you will learn to, I don't even like the word deal in this scenario, but you will learn to navigate those moments in a way that is effective, efficient, and leaves people feeling heard. It won't always be the case, right? There's not a 100% success rate of making every single person happy in terms of practicing medicine, but you get better at it. You do get better at listening, at being present, and at, helping people understand that you're hearing them. And so I don't want that to freak anyone out and for that to be the reason that people start second guessing anything. Because you will have support when you are seeing patients, and you can always tap your resident in, tap your attending in, and be like, hey, this family member really needs to talk with someone. I feel like I've done what I can. Can you step in? And also, as a side, I want to encourage people to ask for help, whether it's in the course and asking an instructor for help, whether it's you're just hearing about Jack Westin for the first time and you want to check in with an academic advisor, whether you are later in medical school and you're in a clinical rotation, asking your whoever is helping you, whoever is your superior, weird word, I don't like it, asking them for help as well. Asking for help and having that growth mindset are two of the best things that you can do to set yourself up for success. All right.
Yeah.
Enough about projection.
Yeah. This also happens a lot. Like I was thinking like most of the issues I had with projection were, some stuff with like patients' families, but also people in like working in the hospital, like interacting with each other. But you can understand why a lot of this stuff like coming at it from the side of view of like hospitals. Because remember, all of these are ways for us to cope with difficult situations. And it turns out people in hospitals are dealing with difficult situations. And so this is something that we're going to see a lot of. Now, so there's three, like Azaii was saying, that I think get often confused. And projection's the first one. There's also displacement and reaction formation. But let's talk about reaction formation first. So reaction formation is when you act the exact opposite of how you're feeling. So somebody who is feeling, let's stick with the MCAT thing. And this is something that I see a lot and like hear occasionally, where like you're overwhelmed, like studying for the MCAT and you're feeling like you're overwhelmed. And so this is where that like fake it till you make it thing kind of comes in, and like, I'm just going to be happy and pretend things are good and everything's great. And so when everybody asks me about how's it going, I'm like, oh, it's going amazing. I'm learning a bunch of cool stuff and I love what I'm doing. And like internally, I'm like, I hate every part of this. And I'm really, really struggling. I feel like I see this a lot. There was somebody I was talking to who was going to medical school last year. So they're starting their second year here soon. But I was talking to them before they went to med school, and they had a friend who was in med school. And they're like, oh, my friend keeps telling me med school is actually pretty easy. Like, and it's not that big of a deal. And like, everyone makes it seem like much harder than it is. And I'm like, nope, not the case. And I'm like, in my mind, I'm like, I don't know this friend, but I feel like there's some reaction formation going on, or they're a genius and like everything is like, maybe that is the scenario. But I feel like I see this a lot because those, like with reaction formation, people tend to be vocal about like, oh, it's actually like, I love my job. I secretly really hate my job. Or like, the MCAT's really easy to study for. Like, I'm really actually struggling studying for the MCAT. And this can be a problem, especially with like social media and forums and things like that. I feel like I'll see people post on Reddit, like, oh, it's actually really easy to study for the MCAT. Like, nope, no, it's not. But I feel like the portion of that might be just people like having this, like, I'm struggling. And so like putting on this brave face, which is kind of what we're taught to do in a lot of society, is like, don't be a complainer, right? Like that's bad. But like if you're struggling, you do want to kind of speak up, like we mentioned. But yeah, reaction formation is acting the exact opposite of how you actually feel.
And, we're not saying that social media forums are just people saying that the MCAT is a lot easier than it is or anything like that. You're going to hear fewer of those voices, right? Because most people will not have that as their first coping mechanism. A lot of the other ones that we've been talking about are ones that get activated perhaps first and more often, I would say, than reaction formation. But it is something to really think about. And when you see posts like those, take them with a grain of salt. Just really do your due diligence. And not just for the MCAT, not just for studying, but in general, you want to make sure that if something big, something important is coming up, that you do your own research into things.
Yeah. I think that there's a part of people that wants to believe that as well, which is why people get
Like if there's like 15 people all saying the MCAT's hard and one saying it's really easy, like you kind of want to listen to that person to see like, how are they dealing with this? Like, cause I just need to do what they're doing. And like, it might not actually be easy for them, but like, I feel like those voices sometimes get amplified because of just, that's what we want to be true.
For sure. The third, wrapping up our trio that can get muddy if we're not careful, is displacement. And so with displacement, we have some kind of impulse or thought, something that we feel the need to act on that's negative. And we with displacement, we redirect that impulse, that negativity to a different object or to something that is less threatening. And so, for example, I might just absolutely hate studying. I am angry. I am furious at all of the time that I have put into it. And instead of, expressing that anger towards the AAMC test writers, I might chuck the book across the room, right? So I have displaced that aggression, that anger that comes with studying and being overwhelmed with studying to an object or something that is less threatening, the book that can't do anything back at me. And that in a nutshell is displacement. But there are so many different ways that displacement can play out. That's just one of them.
Yeah. That's actually healthier than some of the other types of displacement. Yeah. Very often displacement can get like displaced onto like not an inanimate object, but a person. And this also happens a lot in hospitals with patients and families who are really struggling. And so they get upset and angry. And so they start yelling at a nurse. So like, it's not the nurse's fault. Like, it's not the nurse, like what they're yelling at the nurse about is not like what their actual issue is, but they're just displacing this thing. Like, I'm so frustrated against disease and I can't yell at disease because it's not a person or a thing. And so I'm going to yell at you instead. And that's something that can be really hard going through this. That's something that you're going to run into if you work in a hospital. Like, there are going to be times when people are angry at you when they're not actually angry at you. And you're just the nearest target for them to displace that anger onto. You also see this with like spouses, like somebody who is like angry at work and comes home and yells at a spouse, or even worse, like physically assaults them, or a dog or something like that, and takes their anger out on others. I think the reason that this gets confused with projection, sometimes we're talking about the Kennedy's trio can be like confused, because in both of these like cases, displaced and projection, there can be another person involved where I'm like I'm really angry. So it's projection is when I say you're really angry when I'm actually the one who's angry. Displacement is when I'm angry at you and I'm like taking these things out on you when it's not actually your fault. I'm angry at this other thing. I'm angry at studying for the MCAT, so I'm yelling at you. Versus saying you're angry. And those are slightly different. They both involve another person, which is why that could be tricky. Reaction formation also often involves another person, where I say let's take this big scenario and kind of zoom out. I'm angry and I'm frustrated with studying for the MCAT. Projection is when I say you are angry. Reaction formation is when I act like everything's great and I say I'm not angry and everything's wonderful. Displacement is when I'm angry and taking it out on you. And those are three different things that all kind of have this other person kind of involved in this. And because of that, they can get kind of twisted around. I have seen the MCAT ask about, like, anytime I've seen the MCAT ask about these things. Whenever they ask about one of them, the other answer choices are always there of these three. And so you need to be really crystal clear on the difference between those three, because that's something that the MCAT really, really, they know students get tripped up by those. So those often get kind of, I want to say paired up. They get tripleted up, I guess. There's something going on. I don't know what the three version of a pair is, but
I think it would be, no, it wouldn't be triplet. Yeah. Triplet. We'll have to find out.
We'll go with
it. Yeah, there's the next one, and kind of the last one that's going to round us out. I had a lot of trouble with it compared to displacement. And that's sublimation, because both of them involve shifting, similar to, projection and whatnot. It's shifting the focus. So with sublimation, the ultimate way that it plays out, you have this, aggression. Maybe you're really angry about having to study for the MCAT, angry at your progress, whatever it may be. And instead of placing that anger on someone else, you redirect it into a way that is socially acceptable, that is productive. And so what you're hopefully hearing and picking up on is that it might be a healthy mechanism, because you're switching that anger into something productive, something that adds, something that is more acceptable. So the absolutely classic example with any time you're using an example having to do with aggression is sports. Because sports, there's a lot of energy that is being used. Some contact sports have mild degree of aggression with them, and it is considered socially acceptable. It has health benefits, etc. So that's the classic example that you'll hear. Angry at something, feeling aggressive, want to do some kind of aggressive act, getting into sports. That is not the only way that this happens. But the idea being you're taking and redirecting into something productive. And that's where the difference between sublimation and displacement lies. With displacement, I am placing that on someone else, on some object, but it is not unchanged, right? It is still angry. It is still negative. It is not as socially acceptable as an instance of sublimation, which is producing something productive, healthy, definitely socially acceptable.
Yeah. And it can get kind of muddy here. You're right. Like it can get kind of confusing. I actually have a student who actually just took the test just in this last week. But I was talking to him about this and it's important exercise because you think better, especially that last week, kind of before your test. And they're yeah, actually, I've been going to kickboxing every day to just take out, I get really frustrated sometimes to the cat. And so I'm just taking it out on a punching bag. And I would say that is sublimation, which could it seems kind of strange, yelling at a book and throwing the book across the room, or punching a punching bag. Those seem very, very similar. But in one of those is more socially acceptable, right? Or what we would consider healthier. Like somebody who yells and throws books, that's not a super healthy way to deal with this. Somebody who punches a punching bag, yeah, that's an okay kind of good healthy outlet for this. And so this is often what I think of, especially when I think about rationalization, somebody who's well, I just I smoke when I'm stressed and that reduces my stress. So it's healthy for me. I'm okay, there is something there that you're having this stress and this thing does help with your stress. And it is, but it's not healthy. Lowering your stress is healthy. Is there another way to lower stress that might actually be a healthy thing, like kickboxing or going for a walk? Just going to the dog park, right? Going and just playing with dogs, right? Playing with puppies. That's something that lowered my stress a lot when I was in med school, is going to the dog park would just kind of okay, that was I'm in a better place now because of this. And so that's one of the things you want to be kind of careful with. Like I mentioned, rationalization could be healthy, but it doesn't have to be healthy depending on that. And so that's one that's a little bit tricky. I could see getting confused with sublimation as well. Being I smoke because it reduces my stress and therefore it's healthy for me. I would say that's more of a rationalization than a sublimation, which is converting some stress into another one. You also see examples where somebody's whenever I'm stressed, I eat what? Well, let me not project this onto other people. I'm gonna confront this here. Whenever I'm stressed, I really just want some French fries and a burger and things like that. I really just want some food that I know is not super healthy for me. I'm gonna be honest, I do it anyway, and then I rationalize because I'm having a tough day. It's fine for me to eat 2 orders of French fries from Five Guys. But
Your fries are good.
Yeah, they are good. Well, yeah, I kind of hope I have a stressful day so that I can order them later. But yeah, the sublimation would be oh, you have a rough day. Like I said, going for a walk, like calling a friend, like doing something there. I think there are healthier ways of dealing with this. And that's when sublimation kind of comes in. And sublimation is the poster child of healthy coping mechanism, is like approaching this and converting it into another way. Like if you're angry, exercise can be great. If you're stressed and frustrated, like something healthier rather than unhealthy, like convert that in there as well.
Absolutely. There's so many ways to cope with difficult moments, difficult scenarios. And hopefully after listening to this, you can recognize not all of them are healthy, not all of them are unhealthy. And inevitably, we are human. We will use a variety of these, not always the healthy ones. And a lot of this is simply recognizing how we are approaching difficult scenarios, difficult situations, diagnosing the problem, and then thinking about how can I approach this a little bit healthier next time? You don't have to suddenly say, I'm going to stop using all of the unhealthy coping mechanisms today. That is not a smart goal, right? It's not particularly specific, measurable, right? So if you haven't already, taking a look at what a SMART goal is, that we're going to do a whole podcast episode on that, but can be really helpful to help you achieve your goals. But just something to think about as we're wrapping up, and find examples from maybe your own life, or if the examples that we used today were really stuck, use those when you're going to answer the questions on the MCAT.
Yeah. Well, hopefully this helps you recognize whatever coping mechanisms you might be doing. I liked your saying, like, you can't just immediately say, I'm going to quit doing this. Like, even if you tried, like, a lot of this happens without us realizing it. A lot of it is subconscious. Yep. So for me, at least, a lot of this is like looking back.
Yep.
The end of the day, like, did I handle this properly? Like, no, like, I think I overreacted on this thing. And I was actually just talking to my significant other, and we were talking and saying, like, I feel like we're really good at communicating. I'm like, yeah, except for like when we're hungry. When one of us is hungry, we're not good at communicating. Or like if it's at the end of the day, because I'm like, I get exhausted at the end of the day. But I like wake up early and have lots of energy, and like, or at the beginning of the day, like, because that's when you have a hard time. Like, she does not want to sleep in, or she always wants to sleep in. She doesn't want to wake up early. So I'm like, okay, so we're really good at communicating in the middle of the day if we're well fed, and like that's pretty much it. But like this, like just understanding, kind of looking back, understanding triggers. Like there are times when if I am stressed or hungry, like all of a sudden, my coping mechanisms are less healthy because I'm just stressed and having a hard time. And so you may experience this as you're studying for the MCAT. You may find there are times when you are projecting, or you have reaction formation or displacement. I feel like those happen quite a bit. But just kind of understand like triggers, what makes things happen more likely, like why you might be more likely to have a displaced anger. But as we've been saying, like diagnosing is step one. Like realize that's what's happening first, and then you can treat it and figure out how to sublimate and be a healthier person overall.